Hey everybody, it's Dr.Moe from AMH Chiropractic. Thank you guys for coming in today. I really appreciate it. I always talk about how we're always trying to create a new normal and how we're trying to change things about how you live your daily basis and give you a true health talk about how it is that you can change your lifestyle to make it better for yourselves. But what I want to ask is just a couple of you guys, just let me know, what have you heard about chiropractic? Good or bad? Throw it at me. Actually, forget the good. I want the bad. Give it to me.
I heard once you start chiropractic, you cannot stop.
So that's a myth that I hear on a regular basis, okay? The biggest thing with that is there's a definite end to care. But at the beginning, there's repetition. It's like going to the gym 3 times a week. It's like brushing your teeth every single day. You're practicing dental hygiene, okay? You have one spine. There's no such thing as a spinal transplant. God forbid your teeth fall out, you're gonna end up getting veneers, right? But with chiropractic, you might be coming frequently at the beginning, but you're gonna pan it out at the end. A lot of my patients, when they start coming in, we might have to see them once, twice, 3 times a week. But now I have patients that started with me about 3, 4, 5 years ago. I might see them 4 times a year, not 3 times a week for the rest of their life. If I have to see you 3 times a week for the rest of my life, for the rest of your life, I suck at what I do. I'm not getting you better, I'm not getting results. We have to get results. What else?
I heard that only athletes need chiropractic care.
So it's not only athletes, it's your day-to-day people that will benefit from it, because everybody has a spine. Do only athletes have spines? No. Every athlete, every person, every human being has a central nervous system. And that's where we come from with this, the master controller. The master controller of your human body is your brain and spinal cord, which is your central nervous system. Okay? So what controls every cell, tissue, organ of the body? The brain. What's the extension of the brain? The spinal cord. So if there's a traffic jam or an impingement in that area, chances are you're not going to get the signal from the toes to the brain back down to the toes the way that it should be as quick as what it is. So we'll explain some different things with that. Anything else?
Oh, what are some benefits of chiropractic?
You know, the benefits of chiropractic obviously is motion. The old words, or the old thought process of, especially with athletes, you mentioned athletes earlier, especially with athletes, was walk it off. Where does that come from? Increased motion, decreased pain. You're not going to let inflammation kick in. You're not going to let stiffness kick in. You're going to bring blood flow to the area. What's carried with blood? Iron, oxygen, histamine, all this good stuff that processes healing. So when you're putting motion in the spine, you're going to decrease all those things, increase health. Okay? And then there's no surgeries. There's no meds with the crazy side effects. Now, don't get me wrong. I'm not that chiro, and I'll get into this later. I'm not that chiro that hates every medication on mankind. There's a time and place for it. But there's a time and place for it. Not every little sniffle or anything that needs a medication, and we'll get into that a little bit later. Okay? So I'll give you guys a backstory about myself.
There's a question from Facebook. Actually.
Yes.
When is it a good time to see a chiropractor, and when do you know it's time?
So usually when you have tightness and stiffness is the best time to come on in. Because if you're waiting for pain to kick in, chances are it's too late, and that's when I need to see you the 3 to 4 times a week. That's when people hate me at that point, okay? But you want to kick in once you got that stiffness, that decreased range of motion, something where you get out of bed and you don't have a pep to your step. You're not getting up and walking around as quick as what it is. It takes a while for you to get warmed up, because muscles, as you'll figure out in this lecture, muscles is the first thing that you start feeling the symptoms, more than pain. And you'll get why I'm saying this in a few slides here. Anything else? Good? Good. So what I have here is a backstory about myself and why I became a chiropractor, okay? My pride, my joy, my everything are my 3 kids. I do everything on a daily basis for them. I have Ali, Zain, Al-Abidin, and Dalal. So they are why I do what I do, okay? The reason why I became a chiropractor, I was pursuing the physical therapy and or medical field. The reason why I became a chiropractor was because I played football since I was 8 years old. That was during the time where we were taught, you're out there to kill somebody or get killed. You're out there, if you're not out there to hurt somebody, or you're not out there to be the aggressor, you are gonna get hurt. So we led with our heads, we did what we had to do. Guess what that comes with? Concussions. So when those concussions happen, guess what happens? Headaches happens. Migraines happen. I was getting 3 migraines a week, a headache every single day. I was on every med, from Vicodins to Motrins to whatever it was, that you just couldn't even think about it, okay? At 16, 17 years old, that's a lot. Finally go to a chiropractor a month later, 1 friggin' month, okay? No more migraines, headaches once a month. It just got that much better. At that point, passion went through the roof. 6 months I went home and told mommy and daddy, hey, I'm sorry guys, I'm going to chiropractic school. 6 months later, I was moved down to Georgia and followed a passion more than anything else. That's why I love what I do, because I wake up every day and I enjoy it.
Another question from Facebook.
Yeah.
Why orthopedics do not believe in chiropractic?
So the orthopedists, and it matters what regimen or what field or what age group that you're really talking about, because the new age and the newest and most recent studies are telling you that pain meds is the worst thing you could possibly do for pain. The most recent study right now is saying chiros and your PTs are the best people you could do for pain. That's the best thing you do for yourself. So and I don't want to put anybody, say anything or go against anybody. If they don't know or they're against it, chances are they don't know truthfully what chiropractic is, and I hope they're watching me today. So I could at least show them what chiropractic really is, because chances are they went to school 20 years ago, 10 years ago, or they were taught by a guy that went to school 30, 40 years ago, and they were told, hey, chiros are voodoos, they're quacks, they're not real docs. Those are other myths that you hear, okay? But we have just as much training as they do, but they do have more trainings with medications. They have that, 110%. I don't know meds. That's their field. That's not my field. My field is take care of the spine.
Another question, can pregnant women see a chiropractor?
Of course, 110%. We've actually had, I think over the course of the last five weeks, we've had an influx of drastic of pregnant patients coming in. Things that we help with, the baby's turned. I've been certified in Webster's technique, so we could at least take that breech baby, flip them by just a couple soft, gentle techniques. Round ligament pain, I'm sure you pregnant women know what round ligament pain is. We could help with that. Braxton Hicks, we could help with that. So yeah, definitely, that's something. Sciatica is huge, and headaches is huge with pregnant women, and the tables all adjust a certain way for you guys. Yes, good. So back to this. Now I'm officially, my community outreach that I do, as well as I'm a team chiro for Fortson. So I love staying close to my athletes as well. And why did I bring up my kids earlier as well, besides the fact that them being my life? When I was in school, I had my first son, Ali, and I had absolutely no idea what to do with this kid. I knew how to treat my athletes, right? So I had no idea how to treat them. So I took a lot of extra classes just to learn how to treat babies and pregnant women. So that goes on upon with your online question. Chiropractic, and basically what it is, it's basically Greek mythology, means done by hand. Okay, we're actually fixing with our hands. Okay, now I'm not this naive jerk that believes, oh, I'm the ultimate healer, I'm this. No, heck no. I'm allowing the body to do what it's supposed to do, perform optimally and heal itself. I'm just allowing a clear path from the brain to the spinal cord back up to the brain. That's all I'm doing. I'm not taking credit for anything else. That's a higher and better creation than myself. Okay, so that's something that I'm just allowing the body to at least express itself. Okay. So chiropractic, what it is that we're looking for something called the subluxation. Subluxation, long word, easy meaning. Bone moved out of place, pinching a nerve. Plain and simple. You learn that, there's now a traffic jam in the spine. So if you start looking at this bone right here, this bone is shifted backwards. When this bone shifts backwards, what do you think it's going to do? It's going to pinch, it's going to bring down on this nerve right here, this red nerve right here, and cause an interference. Okay? So with that interference being there, there's your traffic jams. There's your histamine that is not going. That is your oxygen that's not flowing the way it needs to go. That's your blood that's going the way that it's not supposed to go. That is your reaction time being decreased. All that is happening there, okay? So this is just a safety pin cycle. You gotta look at the safety pin sort of like the brain. The top of the safety pin is your brain. The bottom is your body. If it's closed, you're adjusted. You're perfectly connected. If it's open, you gotta disconnect. You gotta dis-ease. Okay, so that's something that we need to address. That's something we search for and we fix. We talked about the central nervous system briefly. Go ahead.
Another question from Facebook,
Yes.
From Dr. Nabil Hammam. He's saying, can a chiropractor order an MRA or a CAT scan?
MRA or CAT scan, yes, but it also matters. That's a longer and bigger question, because it also matters about who the insurance is, and what their if they need a referral, HMO versus PPOs, and all that good stuff. If they're auto or private pay, such as your Blue Cross Blue Shields, yes, they can. because we got to make sure for safety as well. We had actually somebody come in today that had some symptomatology that we were really concerned with, and we just refused to talk to them. We refused to even refused to touch them until they went and got that brain scan that we wanted them to get. So yes, we can. Central nervous system we talked about earlier. So once again I said, what controls every cell, tissue, organ of the body? The brain, extension of the brain, spinal cord. Okay, that is where we are focusing. And if you understand the central nervous system, we'll get a little scientific with everybody. The neck and the sacrum it controls your parasympathetic nervous system. Parasympathetic nervous system is your rest, digest, chill, heal. So if this is running haywire, and guess what? Every typical American is go, 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 go. We don't know how to relax. We don't know how to calm down. We live off coffee, Red Bull, Monster, take your pick. We're always go, right? So when we're always go, what happens is this sacrum and cervical region gets shut down. Thoracic and lumbar gets turned up. So when that gets turned up, guess what happens? Sympathetic nervous system. Lions chases us in the field. Excuse my language. We need to shit and get. We need to run. Okay? Blood starts pumping. Adrenaline starts going. When that all happens, you don't know how to calm down. You don't know how to relax. You don't know how to heal. So what I truthfully do at my neurological side of it is, hey, let's just address the cervical and the pelvic area, because that's typically the primary reason why you're being affected and why your muscles are going haywire and why you have these spasms, so on and so forth. That's the method to my madness with addressing the cervical spine and the pelvic spine. So, question earlier was about when should you come in? Okay, when do you need to come in? And this is a prime example of when you need to come in. This is one spinal nerve cut cross-section, and this is basically how it's split up here. Okay, so I want you to look at here. You have motor. Motor is walking, talking, moving, stuff you do consciously. Okay, stuff you think about. Kicking a soccer ball, getting out of bed, tying your shoe, all these good things. If part of the nerve is, the bone is subluxated and it's pinching the nerve, when it's pinching the nerve and it's really affecting the motor portion, because that's 33% of the nerve, you may get symptoms such as weakness, such as spasms, such as fatigue, such as tightness. If you have these symptoms, come see me. Okay? Next is your autonomic. Autonomic is the other 33%. That is stuff that is unconscious, it's automatic. You don't think about it. Liver function, kidney function, heart function, so on and so forth. Some symptomatology that you get from this is sinus and allergies. If you got sinus and allergies year round, chances are, my dude, you do not have a seasonal allergy complex. You have something going on in the nervous system. So let's take a look at it. Okay, low energy, digestive problems, huge. Huge, huge, huge. We actually have this this is for babies, and this is for pregnant women, and this is for the elderly. We have a big board in Livonia, and we asked people, hey, what does chiropractic help you with? And somebody wrote in big, huge, bold letters, pooping. Okay? And if you look at our Google reviews, one of our Google reviews is a mom saying how she's never been so happy to change 3 poopy diapers after seeing us. Okay? Because we could help with that digestion, because, go back to the previous slide, when we're talking about the parasympathetic nervous system, what does it do? Rest, digest, chill. Okay? Next is the sensory portion. Sensory is your tasting, feeling, seeing, hot, cold, posture, pain. Fun fact of the day, if you take nothing home, you take this home. Only 6% of the nerve is responsible for pain. That's it. Done. So you're waiting for pain to kick in, you're waiting too long. Catch it during these other symptoms. Catch it during the muscle spasms, the fatigue, so on and so forth. That's when you come see me. Okay? So this is a little bit smaller, and I know it's tough to see, especially online, but this is the biggest thing of saying, hey, what it is that we do and how it is that we help. So for example, if you go in and you tell me you got migraines or you got headaches or you got so on and so forth, we like looking at this vertebral level. The first one right up here, look at the biggest thing right there, headaches and migraines. You start telling me you got dizziness, okay, we go into C2. So that shows us that there's something going on in that area. Everything is interconnected. If you come down to the sacral area, we got bladder, we got organs, we got reproductive systems, okay? I had this funny story that I'll make it quick and we'll get through it. I had a patient come in, this was 3-4 years ago, having a hard time getting pregnant, okay? Said, hey, I've tried everything else. I don't want to do the in vitro yet. I'm giving this my last ditch effort before I get into that. I said, okay, perfect, let's do it. Husband loved it because I told him, he said, what does he need to do? And I said, you guys just need to keep on trying. So he loved that idea, okay? So what we ended up doing was just addressing the sacral area, making sure that the sacrospinous ligament S1, S2, S3, S4 was shifted in the correct positioning. It was about 3 months of care. They come in screaming, okay? Granted, we had people in there. She came in screaming, "Doc, you got me pregnant." I had other patients there, and I'm like, "Oh my God, I'm married. What the hell are you saying? What do you mean? People don't understand what you're saying." So it was a good story. It was funny, but it worked out so well, and it was awesome. It was just something that just doesn't ever go away from me, okay? Other stuff. So I had this up there because when people tell me, "Hey, I got pain running down the leg," okay? Well, chances are, tell me where in the leg. Is it on the front side, back side, in the middle, and on the outside? Where is it? Or I got pain right here on my thumb. I got numbing and tingling right here on my thumb. I start adjusting their neck, and they look at me like I'm crazy. Like, well, I told you my thumb hurts. Why are you adjusting my neck? And this proves to you what's going on here. That is called your dermatomal levels. Your dermatomal levels, C6, is actually responsible for this region right out here. Okay, from here to elbow. C5 is from here down. C4 is up here. Okay, same thing if you look down here, you got, your L1, your L2, your L3, your L4, your L5, your S1. So if I just shut my mouth and listen during the history, which I do pretty good, and you tell me specifically where your pains are and you're good at explaining what's going on, I'll pull teeth. I'll talk to you for an hour. I don't care. Because you're going to give me a majority of the answers that I'm looking for in the history. Hardly have to examine you. I'm examining you to confirm what we talked about. Okay, so if I were to just shut up and listen, which once again I do that, you tell me a lot of the stuff of where this pain is coming from, what kind of pain it is. So phase of degeneration, this is what we're trying to stay away from, okay? We're trying to stay away from this degeneration here. So obviously if you're at a phase 1 or phase 2, we could return you to near normal. There's a couple things that come in there that are irreversible, okay? So when you're looking at like these bony spurs that try to form, irreversible, we're not gonna get rid of those. But what we can make sure is that you don't get any worse. You come into phase 3, we gotta make sure you don't get worse. Phase 4 is where you're looking at either any type of surgical stuff or bracing or just trying to make quality of life better. So our biggest thing that we start seeing people is between this phase 1 and 2, because that's usually where the nerve starts getting pinched. And that's usually when it's been in course or in action for about 5 to 7 years. And that's when the pain starts kicking in, because they don't listen to their body. They don't listen to the muscle spasms. They don't listen to the fatigue. They don't listen to the pains once or twice a month. They take a Motrin to shut them up. They wait until the pain's 5 days a week, 6 days a week, 7 days a week, and then they come in. Okay, so that's what we're looking for there. We do take x-rays in our Livonia office. We have x-rays. If we believe we examine you in our Dearborn Heights office and you need x-rays, we will send you to our Livonia office to do x-rays. Okay? Or we'll send you back to your PCP, because we're affiliated with a lot of PCPs that we deal with, and they take care of it for us. Okay? So this is a prime example of that. I'm me, the chiropractor. I am letting the body perform optimally. The body is self-healing. It's a beautiful thing. Okay, so I just want to talk to a couple of you guys right now. So let's see how this goes. So when you have a fever, what do you think is going on? Why is your body fevering? Any idea?
Trying to fight something.
Trying to fight something. Okay, so let me ask you guys a question. Camping, if we're going camping and you run out of water, if you take water from the stream, how do you make that water drinkable water?
You heat it up.
Heat it up. Why?
So you could get rid of the bacteria.
Kill the bacteria. Thank you. Denaturing the bacteria at about 100 degrees. Okay? So what's your body doing when you got a fever? Trying to denature the bacteria. So if we shut that sucker up with Tylenol, what's going on? That bacteria is going to have time to grow and multiply and become bigger. So when that happens and 4 to 6 hours later the fever wears off, that bacteria just grew. So now instead of 100-degree fever needed to denature this bacteria, you needed 103-degree fever to denature this bacteria. So it's very imperative to let the fever run its course. But you have to always pay attention to symptoms. You always have to pay attention to, is the patient lethargic? Is the person not moving around? Are they that miserable? Then yeah, you gotta take it down, But let's see how they're reacting, okay? Other thing, shivering. When you're freezing cold, what does your body do?
Just trying to
Shit.
make
Trying to warm you up.
Warm up the heat. It's warm you up, heat you up. When you vomit, beautiful thing. People take I forget the name of the Zofran. People take Zofran to stop the vomiting. Why? What's the vomiting doing? It's getting that toxin out of your system. It's allowing you to get rid of it and expel it because your body's such a beautiful thing. It was built without a single screw, a single lug nut, a single anything. It was just built that way. Because it's imperative and very awesome how it's built to self-heal. So when you're vomiting, you get food poisoning. You're expelling and getting rid of that toxin that's inside your system. Okay? Sweating. Once again, homeostasis. Okay? Same thing as your fever, same thing as when you're sweating, it's your body, you're overheated. It's trying to cool you down. So the body is a beautiful thing if you listen to it and let it do what it's supposed to be doing. We all have this system inside of us. It's called your neuroendoimmunosystem system. So let's go back to that cross section of the nerve and the autonomic portion. If you're this type that you get sick 4, 5, 6 times a year, chances are you have an immunodeficiency. What controls the immune system? Your nervous system. What controls every cell, tissue, organ of the body? The brain. Central nervous system, brain, spinal cord. Getting sick frequently, immunodeficient. Your neuroendoimmunosystem system is huge, okay? So it's definitely something that you need to pay attention to see if you're getting sick for a while or if you're getting sick frequently and staying sick for a long time, okay? Another reason to come and give us a try, talk to us. Second brain. The second brain is known as your stomach. Believe it or not. Your stomach is your second brain. Besides the brain, there's the most nerve endings in the stomach. So when people tell you, go with your gut feeling. Why are they telling you that? It's something in your brain telling you, go with your gut feeling. It's your second brain telling you, go with your gut feeling. So when you start doing all these different things and you start eating like crap, don't you think that's messing up your stomach? Which is messing up your second brain, which is throwing off your hormones. Everything's interconnected. Everything happens for a reason, especially in the body. Okay? If you just listen to it. 3 types of stress. People come in on a regular basis. No exaggeration. They come in on a regular basis and they tell me, I'm hurt. I don't know why. I didn't do anything this weekend. We get to talking. We get to chatting. We get to seeing what's going on. They tell me they're going through a divorce. They tell me that a loved one died. They tell me that they got fucked. That's emotional stress. That emotional stress, that mental stress will tear you apart physically. No exaggeration in that. So yeah, you didn't do anything physically, but you did something emotionally. And that emotional stress will tear you apart hormonally as well. Okay, so that's a huge thing. Biggest thing, stop eating crap. Once again, excuse my language. Carbonated junk, refined sugars, artificial shit, and processed foods. Okay, this stuff makes your body more inflamed. It makes your joints that much more stiffer. Okay, it slows everything down from your GI tract to your brain to everything. Okay, so these processed foods that are rich in GMOs and rich in sugars and preservatives, for example, your Diet Pepsis that everyone loves. Okay, they're made with phenylalanine. Phenylalanine in the human body turns into formaldehyde at a certain temperature. So what they E-bomb the dead bodies with is what you're drinking. Okay? So that's the artificial crap that you don't want to be taking. You know, some stuff, sick care versus health care, there's a lot of good docs out there. I'm not going to name any that I deal with on a regular basis, okay? They are a true healthcare profession. Then you got your sick care profession that is all about come to me when you're sick, okay? I want to see you when you're not sick. I want to be preventative with this thing. I don't, when you come in and you're hurting, I'd love to fix you, but I also want to maintain you. I want to make sure this doesn't happen again. Get results quick, keep them there for a long time. We do that, you're a happier camper, okay? Fun fact of the day. Another fun fact of the day, I'm sorry. Viagra. Viagra is widely used, okay? Why was Viagra first brought into this world? Blood pressure, right?
The heart, right?
The heart, yeah. Okay, what was the side effect?
Heart attacks?
4-hour erection.
Okay.
What sells more? 4-hour erection. Okay, so they transitioned it from a blood pressure med to an erectile dysfunction med. So that's your sick care. That's come to me when you're sick. Okay. With us, I do a lot of your vitamins, your standard processed vitamins, your essential oils, your diet. I'll have people do diary, food diaries for me. Let me know what the heck's going on, because if I am the world's renowned greatest chiropractor in the world, which hopefully one day I will be, okay? But if I am, and you come in and you leave, or you come in, you get fixed, and then you leave, and you get a six-pack and go to McDonald's every day, junk in, junk out, man. I can only get you so much. You're not helping yourself. How am I supposed to help you? You got to be your number one advocate, yourself. Help yourself. And I'll help you. I'll push you to do that. But you have to want to. This goes on to explain just about how we are very good at blocking or putting a Band-Aid on what it is that we're feeling. So if a check engine light comes on in your car, are you putting a Band-Aid over it? You're taking it to the dealer and you're going to get it checked. So when we have a headache, when we have a fever, when we have a infection, why are we shutting that up with your amoxicillins, your Benadryls, your whatever? Listen to the body. See what's going on. The Tylenols, the Motrins, the pain, especially for pain. It's one of the worst things you could do. Okay? This is just some kids that we see in the office because everyone's like, Chiro for kids? Oh, no way. There's no way in heck we could do that. Okay, yeah, that's cool. Whatever your belief system is, that's fine, but it's just not true. And I want everybody here, everybody watching, take one hand, place it on your eye. That slight pressure that you put on your eye, and you feel that pressure right there, it's about 6 pounds of pressure, not even. That's the amount of pressure that the baby gets for an adjustment. It's a gentle touch. That's all it is, especially for baby, because they're not bones yet, they're elastic. So you're checking that, and stuff that helps with babies is their colicky, their constipation, their gassy, their a lot of the torticollis. A lot of babies as well, when they're breastfeeding or feeding, they only like to feed on one side, so their head's always turned a certain way. That's a misalignment of the spine in the baby. It's a telltale misalignment sign. Okay? So, what controls every cell, tissue, organ of the body? Brain. Okay, what connects the brain to the body?
Spinal cord.
Spinal cord. Okay? That's that arrow there. So if that's working in perfect harmony, how do you think that you're functioning?
Good.
Pretty good, right?
Yeah.
Okay, so you're full function, 110% functioning. You think you're bending down and tying your shoes with ease? You think it's easy to do so or hard to do so?
Easy.
Easy. So you got a lot of ease in your life. Okay? If you think you're sick on a frequent basis, or you're feeling pretty good?
Feeling pretty good.
Okay? So you have health and you're feeling good. So let's go in here. And let's throw in a subluxation there. Subluxation is that red slash there. Okay? That's your nervous system disturbance, your subluxation. Now instead of functioning, you have some malfunctions going on in your system. Okay? Do you think you're still living in full and utter ease?
No.
You got some dis-ease. Okay? Do you think you have full and utter health? Okay? You have some ill health. Okay, instead of feeling good, you start to feel bad. Okay? Now here's my question for you. If you were to come to my office and I tell you, hey, we could get rid of this pain, that's it. We could just do this right here. Just get rid of that. Would that be suffice? No. Okay. What do you think would happen if we do that?
And all the other things will still be present.
Everything else will start coming back, right?
Yes.
So what we really need to do, because these are your effects, we're not fixing the root cause there. We fix the root cause, then you're a happier camper, okay? Sorry. Then you're a happier camper, which is this, the root cause. The nervous system disturbance, the subluxation. Instead of working on, hey, my effects are, I can't sleep. I can't play with my kids. I can't do this, I can't do that, okay? So what we end up doing is we just trying to fix it to the point where not only is it going away and the symptoms getting better, it's gone for good. We're making correction, and this is how we make the correction.
A question from Facebook.
Yes.
What does phenylalanine and Diet Pepsi do to the body?
Phenylalanine turns into formaldehyde. Formaldehyde E-bomb is what they use for E-bomb. when they e-bomb the human body, when you die, preservative. It's a preservative. So you're pre-preserving the body. It's a neurotoxin. It affects the nervous system drastically. It slows you down, causes inflammation. That's just to name a few there.
That was a question from Ramzi Yunus on Facebook. Another question from Jafar is, how long does it take for a neck pinched nerve to heal while taking naproxen and going to therapy?
So the therapy is awesome. If you look around here in our office here in Dearborn Heights, we're actually with Max Pro Rehabilitation. They're a fantastic company, but they work great on muscle, tendons, ligaments. I work great on bones, nerves, and disc. So if you got a pinched nerve, chances are you should see me. Okay. How long will it take? Naproxen, once again, like we talked about earlier, it's not gonna heal anything. It's gonna get rid of the pain. Stop taking the naproxen, pain comes in. It's not going to get rid of the pinched nerve. It's going to put that Band-Aid on the symptom.
So basically, stop taking naproxen and come see a chiropractor.
So I can't tell you to stop taking a naproxen.
Okay.
I can't do that. I'm not a medical doctor, but I could tell you, yes, come see a chiropractor, because for a pinched nerve, coming to see a chiropractor would be the best, and you could probably get rid of, or at least 50% better, 6 to 8 visits. 6 to 8 visits. Yeah. What else? Anything else? Nope, good. So, last thing that we're offering here tonight is, if you come on in, if you mention this on the Facebook Live, if you pick it up from us today, we're giving our VIP pass. Okay, this is if you don't have any insurance coverage. We do accept all major insurances. Your Blue Cross Blue Shields, your Aetnas, your Medicare, some of your Medicaids. Just give us a call. We'll do a straight a courtesy verification check to see what we are in network with. And what your coverage is. If you're not covered, it's $89.95. Covers your exam, your x-rays, your consult, your surface EMG scan. Covers everything for that first day to let me thoroughly check you, see if I could help you. If I could help you, great, I'll let you know. If I can't help you, I'll also let you know and say, hey, this is a muscle problem, you need to go see a PT, or get a massage, or what. I'll tell you what you need. Okay, so you mention this and you get this special offer, and we'll go from there. Any other questions?
I actually had a question about one of the PowerPoint slides. On
Which
the
one?
PowerPoint slides, you had like phase 1 to phase 4. So like, what's the cause of that going from phase 1 to phase 4? Like, what's happening in those pictures that makes that end result?
You're talking about this one right here.
Yes.
Okay. So what makes it, age is huge, okay, but it's usually a trauma. A trauma will happen and cause something like this, a reversal of the curvature, and then doing nothing about it. Taking your naproxen, sitting down, waiting for it to go away. It'll continuously to get worse and worse and worse. So not fixing an underlying issue that has been there for a very long time will cause it to get progressively worse.
Thank you.
No problem. Anything else? Comments, concerns? Good. Thank you guys so much. I appreciate you. If you guys have any other questions, feel free to email me. It's dr.moe@amhchiropractic.com. Give our office a call. Livonia 734-525-0200. Dearborn Heights is 313-769-5354. You can follow us on Instagram, applied_modern_health, or on Facebook, Applied Modern Health or AMH Chiropractic. You will see us in Livonia. Thank you guys. Have a good one.